Good day, Mark. I'll be having a good day so far. Today, I would like to present one of the cases from my client, Lani, and the current ethical dilemma that I'm facing. Lani, age 10, which I deem to be not a mature minor, suffered from her parents' divorce. Lani's mother has requested our help due to the fact that her school performance has been steadily declined. Before the therapy began, we discussed the informed consent as well as the limit of confidentiality. For extra information, she stays with her mother and she stays with her father on the weekend. Now, during one of our sessions, she told me that her father locked her up in her bedroom without any dinner and restricting her connection to her friend. She told me that she does not want me to tell anyone due to the fact that it might anger her father, and this terrifies her. Now, the ethical dilemma here is: do I preserve the request of Lani in the risk of harming Lani just to preserve our relationship, or do I disclose the information to Lani's mother, but in return jeopardizing my relationship with Lani as the patient therapist? Um, the value chat I could see tripping up is as growing as an Asian country, I experienced a lot of physical punishment, such as canning on my hand, rubber pipe, eating raw chilies, being left in the dumpster, and the worst from my memory is being beaten by the belt. Now, this may seem harsh to everyone outside, my culture, but this provides a bonding experience as well as learning lesson with my friend, because most of us were disciplined like this, except for the dumpster part. However, this punishment aren't without a cause. They will aim to teach me as a young kid a lesson whenever I make a big mistake. So I believe the necessary physical punishment is acceptable if it provides benefit to the one receiving it, and if there's a reason for it. Additionally, I consider myself to be somewhat an empath or emotional individual, especially towards animal and children, fictional or real. Therefore, with Lani's situation with her father, I can see myself being infuriated due to Lani's unfairly being punished, especially because Lani is innocent. My personal belief that harm is justifiable as long as it benefits oneself directly conflicts with the APS code propriety, which aims for beneficence and non-maleficence. Furthermore, the culture here allows little to no right slash flexibility to children with the mindset that adult most often knows what best for them, which may affect my perspective of autonomy in the APS code of respect. Um, Drawing upon the APS code of ethics on the key ethical right and responsibility, I managed to identify the key rights of Lani's, her mother, her father's, as well as the psychology, which is me on the case. Um, Lani's mother, as the paying client, has the right to understand and know the reason for her daughter's declining performance. Um, she has the right to know, and any information that came from the therapy must be disclosed and be provided, especially when it's relevant. Lani, on the other hand, despite not being a paying client, is the recipient client of the psychological therapy. And as a psychologist, I have to respect her legal rights or and the autonomy as well as the justice that is involved in surrounding with morally with APS code of ethics. Although it can be quite tricky because she is a non-mature minor. With Lani's father, I guess he has the right to father or govern impose his law on his daughter. He also has the right to understand the predicament that his action is doing, but I do understand that he is vulnerable from the recent divorce. And as a psychologist, the main three principle of APS code of ethics is respect, propriety, and integrity. In terms of respect, we respect the right to autonomy and justice while promoting equity and protects people's human, legal, and moral rights. Propriety, we aim to benefit and not inflict harm. We aim to protect the interests of colleagues we work with, which take precedence over our self-interest. And in integrity, we recognize that our knowledge and professional standing put us in a position of power that we must exercise appropriately. And in regards to non-maleficence, Victoria requires a mandatory reporting under the Children, Youth and Families Act 2005, where mandatory reporting must make a report to child protection if they form belief on reasonable ground that a child is in need of protection from physical injury or sexual abuse, which said the same similar with APS guideline 8.5.2, where information immediate or specific harm to an identified person or the person that can be avoided only by disclosing information, essentially breaking the confidentiality of for individual safety. Confidentiality can be extremely tricky, especially when involving minors that refuse to disclose any information outside the therapy. Multiple studies try to explore deeper into this complex ethical situation. Levelsky, for example, 2008, indicate that school counselors address the issue of confidentiality with extreme concern, and they do not decide to breach confidentiality very easily. And when they do, they provide a sound and justifiable reason for doing so, relying on ethical and legal standards as well as professional, personal priorities, values, as well as consulting many sources of information in order to form the ethical decision, which include updated law, procedure policies, colleague, supervisor, and professional organization. Meanwhile, Jackson 2014 presented a youth confidential guideline which aimed to provide a series of steps which health professional can make the best or the most ethical and appropriate decision based on the evidence gained from the minor client. The guideline consists of gathering information, explaining the limit of confidentiality, whether as require the intervention of the child protection, identify disease, pose imminent danger or harm, court order, as well as assessing the age of the minor, level of intelligence, decision-making capabilities, ability to understand informed consent illness, and whether they live with the parent or not. Meanwhile, Smith 2015 stated that the decision to breach confidentiality should not be taken lightly, and that school counsel must judge if there are circumstances that justify breaching confidentiality. Smith additionally found that in the area of self-harm or harm to others, that age is not a relevant factor, as well shows that harm will consider a highly valid reason for breaching confidentiality. From these studies, I highlighted two possible solutions for the current case, which involving the guidelines from the past studies. Through multiple stages, I can make a level-headed judgment after collecting and assessing all the relevant information from Lani. In regards to the dilemma of Lani's refusal to let anyone know about the abuse, I believe that Lani's mother has the right to know for the reason of her performance decline. But I also believe it's an opportunity for us to educate Lani and let Lani understand her other and better options. This way we can bring Lani as part of the solution without undermining her and making judgment for her, which allows for Lani's autonomy growth and understanding her right. Another solution that I'm considering is the support from professional and supervision of colleague. Matt Coley 2005 and previous mentioned studies consider colleague, supervisor, and professional organization as a medium of supporting network when involving making critical decisions that can affect the life and well-being of others and ethical conflicts. The pros and cons for the first resolution is that it consists of multiple guidelines which has a clear system to follow without being lost. We also include Lani in the process, which hopefully allows her to understand her option and allow her to grow as an individual. There is also a potential for Lani to reject the notion, which can complicate the whole situation. And for second resolution, the collective experience of professional colleague can be tremendously improve you in reaching a sound ethical solution. However, experience can form different opinion and approaches to ethical decision, which can inflict further conflict and difficulties into the decision-making process. The ethical difference can provide additional challenge I consider to be a significant negative. And another potential problem which PASTA is shown with consulting supervisor is the potential for power imbalance, where line manager will primarily concern with administering tasks and resources allocation, and therefore will not seen as well placed to offer supervisory advice on complex practice and ethical issues. Based on this information, pros and cons, I will definitely choose the first resolution where I will gather enough information about Lani, as well as expanding Lani's resources, which allows her to understand the decision and why I'm making it, and hopefully will encourage her to speak up and disclose information to her mother. I will also have a follow-up session to see where it goes, and hopefully by the end of it, everyone will be happy with the solution, and Lani will become even more brave, and it helps her grow as an individual, and everyone will be happy. Thank you very much.